Hello everyone, my name is Emma Weinberg and I am a pediatric occupational therapist practicing in the KZN Midlands. I have a special interest in early intervention and working in the neonatal ICU, and I'm excited to have the opportunity to just help you understand what happens in the NICU a little bit better today. So if you are here, it means that your baby's journey began a little differently from what you had planned. The NICU can feel really overwhelming, filled with unfamiliar sounds, new faces, medical equipment, and so many questions. It's really not the beginning that any parent envisions, but it's also a place of remarkable strength, of healing, and of resilience, where tiny victories happen every day, and where you and your baby are learning to navigate this path together. Today, I want to walk you through what this journey looks like and explain some of the things that you'll see and hear, and remind you that even in all of this, you are the most important part of your baby's story. So one of the first things that you'll notice in the NICU is the team. Your baby is surrounded by nurses, doctors, possibly occupational therapists, physiotherapists, and lots of other specialists possibly as well. Everyone's role is to help your baby to grow stronger. In the NICU, your baby is cared for by a highly specialized team, and at the center of that team is the pediatrician and the NICU nurses. The pediatrician oversees your baby's medical care. They monitor their growth, they manage their medications, and they ultimately guide the decisions about feeding and breathing support and making sure that all the systems are developing as they should. And they also coordinate with the rest of the team, so the OT, the physio, the dietitians, and other specialists, to ensure that your baby is receiving truly holistic care. But it's the nurses who are at your baby's side every moment of the day and night. NICU nurses don't just check monitors and administer feeds. They are deeply attuned to your baby's cues, to their comfort, and to their rhythms. They know when your baby is unsettled and when they are ready for more stimulation and when they just need to be held gently and left to rest. They are your baby's advocates and protectors, and they're often a lifeline for you as a parent as well, explaining, guiding, comforting, and celebrating every small win alongside you. This team becomes part of your baby's story, and you as your baby's parent are part of theirs as well. Together, you are all working towards the same goal, helping your baby grow, heal, and thrive. Then there are all the wires and the machines, the monitors and the beeps. They can feel really overwhelming, but those beeps are not there to scare you. They are the safety nets that watch over your baby every second so that you can focus on loving them. So let's look briefly at what each pipe and wire does for your baby. So the first one is the feeding tube. It will be an NG tube or an OG tube. So it will be a nasal tube where it goes into the nose, or an oral tube where it goes into the mouth. It's basically a soft, flexible tube that delivers milk or formula directly into your baby's stomach. Babies in the NICU often aren't ready to feed by mouth yet because coordinating, sucking, swallowing, and breathing is really complex, and it develops over time. So the feeding tube ensures that your baby gets the nutrition that they need to grow while they build those skills. Then your baby might have an IV line, an intravenous line. An IV line is a thin tube inserted into a vein, usually in the hand or foot, sometimes in the scalp, and it will most likely be secured with a plaster or a soft wrap to keep it safely in place. It's used to give fluids, medication, nutrients directly into your baby's bloodstream. IVs are especially important in the early days if your baby can't tolerate full feeds, or if they need antibiotics or glucose or other important medications quickly and safely. Then we have the pulse oximeter. So that is a small sensor usually wrapped around your baby's hand or foot that uses light to measure how much oxygen is in their blood. And that is known as oxygen saturation, or SpO2. The reading of SpO2 helps the medical team to know whether your baby is getting enough oxygen and whether any breathing support or oxygen adjustments might be needed. Then you'll see the temperature probe. The temperature probe is a tiny wire placed on your baby's skin, usually held in place with a soft little adhesive patch, and it connects to the incubator or the warming bed and helps to regulate your body's temperature by signaling the heater to warm up or to cool down as needed. And that allows your baby to conserve energy and focus on growing rather than struggling to maintain body temperature. Then you have your cardiopulmonary monitor or your vital signs monitor. And those are those little small stickers with sensors, which are called leads, and they are placed on your baby's chest and wires connect them to the monitor. And that allows the medical team to watch your baby's heart and breathing rate in real time and respond quickly if anything changes. Then you'll see the blood pressure monitor. A blood pressure monitor works very much like the one that we use for adults, but it's specially designed for tiny babies. So a little small cuff wraps gently around your baby's arm or leg, and it inflates briefly to measure blood pressure, and that helps the team to assess your baby's circulation, their heart function, especially if they are on medications or have had any medical complications. Then you will see a screen above your baby's bed showing different numbers and lines. That is called the vital signs monitor, and it gives the team real-time information about how your baby is doing, which it receives from all of those wires and leads that we've just spoken about. So let's look at what each number usually means. So the heart rate is usually in green, and that tells us how fast your baby's heart is beating. So we want a normal range between 120 and 160 beats per minute. It might be a little bit lower when your baby is deeply asleep, or a bit higher when they're crying or unsettled. Then we have oxygen saturation, or SpO2, often in blue, and that tells us how much oxygen is in your baby's blood. The target range in the NICU is usually between 88 and 95% in prem babies, sometimes higher in full-term babies, and that number might dip briefly, which is really common, and the team is trained to respond if that number stays too low. And then the respiratory rate, often in yellow or white, that's how many breaths your baby is taking per minute. So the normal range is between 30 to 60 breaths per minute. Preemies often have irregular breathing patterns though, sometimes fast and then slow, and the monitor helps us to track that safely. Sometimes alarms will go off. Often, it's just a gentle reminder that something is slightly out of range. It might be that a probe slipped or your baby wriggled. It doesn't always mean that something is wrong. It just means that the team is watching closely so you don't have to worry alone. Some NICU babies need a treatment called phototherapy to help lower high levels of bilirubin in their blood. Bilirubin is a natural substance that forms when red blood cells break down, but newborns, especially premature babies, the liver is not yet mature enough to process that quickly. So when bilirubin builds up, it can cause jaundice, which shows up as a yellow tint to the skin and the whites of the eyes. It's very common in newborns and usually temporary, but when levels get too high, treatment is needed just to prevent complications. So phototherapy uses a special blue light that helps break down the bilirubin so that your baby can pass it more easily through the liver and their kidneys. Your baby will lie under the lights in just a nappy with soft eye covers to protect their eyes. The treatment is safe, gentle, and very effective, and most babies only need it for a short time. Your baby's bilirubin levels will be monitored regularly through blood tests, usually a very small prick on the heel. These tests help the doctors to know how well the treatment is working and if it's safe to stop. If levels rise high again after phototherapy, treatment might be restarted, but the care team will keep you updated and explain each step along the way. Even though your baby might be surrounded by wires and tubes, your role doesn't get smaller in the NICU, it gets bigger. You are your baby's safe place. Your voice, your touch, your smell, those are what they know and love and are just as important as all of the wires and monitors. Some NICU babies need a little bit of help to breathe while their lungs get stronger. So we have got a whole bunch of different machines that support, and they are just tools. They don't define your baby and they don't define your baby's future. Sometimes a ventilator does the breathing for them when they're too small or too tired to breathe well on their own. So the vent gently pushes air into your baby's lungs through a tiny tube placed in their windpipe, and it gives their lungs a chance to rest and to grow stronger. Sometimes when a baby's lungs are very fragile or not responding well to a regular ventilator, the medical team might use a special type of breathing machine called a high-frequency oscillator. Unlike a conventional ventilator, it gives Unlike a conventional ventilator that gives slower, deeper breaths, the oscillator sends tiny, rapid breaths into the lungs, often hundreds of times per minute, and these gentle, quick movements help to keep your baby's lungs open and deliver oxygen while reducing risk of lung injury. Some babies might be put onto CPAP, which stands for Synchronized Intermittent Positive Airway Pressure, which gives gentle, timed breaths to help support your baby's own breathing efforts. It's like a little boost that helps their lungs open and close more easily. Sometimes CPAP, or continuous positive airway pressure, is used, and that's delivered through a soft mask that fits over your baby's nose, providing steady flow of air pressure to keep their lungs open while they breathe on their own. Often the last step is just a little bit of oxygen through a nasal cannula, which is a small tube placed just inside your baby's nostrils, and that helps your baby to get enough oxygen as they transition onto breathing completely on their own. Every baby's journey through these breathing supports is unique. Some babies move step by step from ventilator to CPAP to CPAP to nasal cannulas. Others might start in the middle. Sometimes they might need to go back to previous support for a little while. The pediatrician, supported by the nurses, carefully monitors your baby and adjusts the support to help them breathe as independently and comfortably as possible. Feeding is another journey. Many NICU babies start with a tiny feeding tube, like we said before, a soft tube that carries milk into their tummy because they aren't yet ready to coordinate sucking, swallowing, and breathing all at the same time. We said that sometimes the tube goes through the nose and is called an NG tube. Other times, especially if your baby is using nasal breathing support like CPAP, or if their nose is very small or sensitive, the tube goes through the mouth instead, and that's called an OG tube. Most types of tubes serve the same purpose to ensure that your baby gets the nutrition that they need while they grow stronger. It's temporary, and it doesn't mean your baby won't breastfeed or bottle feed later. The team will support you and your baby to develop feeding skills as soon as your baby is ready. Remember that your milk is medicine. Every tiny amount, just drops at first, are precious and help build your baby's gut and protect them from infection. If you are expressing milk, whether by hand or pump, you are giving your baby something really, really special. To help your milk come in and keep flowing, it's important to express frequently. Even small amounts count. It's better to express little and often rather than trying to get large amounts further apart. There are also some gentle ways that you can support your body. So you can stimulate your nipples, encouraging your body to release milk, and that can be done by gently rolling or rubbing your nipple. And then breast massage helps improve circulation and milk flow. So you can try gently massaging your breasts in slow circular motions. And then really, really important, thinking happy, loving thoughts and spending time skin to skin with your baby can help your body relax and signal that it's time to produce milk. Our bodies are deeply connected to our emotions and thoughts. So when you think positive, loving thoughts about your baby, your brain releases hormones like oxytocin, which is often called the love hormone, which plays a key role in milk letdown, helping your milk flow more easily. Feeling calm and connected can make a real difference in how your milk comes in and how well you can express it. If you can't express enough milk yet, or if donor milk or formula is needed, that's okay too. What matters most is that your baby is nourished and loved every step of the way. The team will support you and your baby to develop feeding skills when your baby is ready. When your baby starts to show signs like stronger sucking, rooting, improved breathing, this signals that they are now ready to begin feeding. Kangaroo care, or holding your baby skin to skin, helps to encourage these signs to appear sooner. Feeding is not just about nutrition, it's also about connection, and you're the most important part of that process. Sometimes other specialists, like speech and language therapists and dietitians, might be brought in to provide extra support around feeding. The speech therapist is specially trained to assess and support your baby's ability to safely suck, swallow, and breathe during feeding, and they will work with you to find the best feeding positions and techniques, and may introduce strategies or equipment if needed to help your baby to feed more comfortably and effectively. The dietitian focuses on your baby's growth and nutrition. They carefully monitor how much your baby is eating and growing and advise on the right balance of nutrients that your baby needs at each stage. They also help guide you if your baby has special dietary needs or challenges with feeding. Together, the speech therapist and the dietitian work closely with you and the rest of the team to ensure that your baby's feeding journey supports healthy development and builds a strong, loving bond with you. And then your role as a parent in the NICU. It's easy to feel helpless, but you are the one thing that your baby needs the most. Your touch, your voice, your smell, you are their world at this point in time. And there are some special ways that you can connect with your baby that helps them feel safe and supported, even when they are tiny and surrounded by machines. So skin to skin, or kangaroo care, KMC, means holding your baby dressed only in a nappy directly against your bare chest, and you can use a blanket or your clothes to keep both of you warm and cozy. Skin to skin helps to regulate your baby's heart rate, their breathing, their body temperature, and it also boosts their brain development and supports breastfeeding. Your baby feels your warmth, hears your heartbeat, and smells your scent, all of which soothe and calm them. Your occupational therapist might provide you with a Kangaroo Mother Care wrap, which is a soft, stretchy fabric wrap designed to securely hold your baby close to you during skin-to-skin care. The wrap helps keep your baby safely positioned and snug while allowing you to move your hands freely. And because it gently hugs your baby, the KMC wrap mimics the comforting, enclosed feeling of the womb, helping your baby to feel safe and calm. So using the KMC wrap can make skin-to-skin easier and more comfortable for both of you, encouraging longer and more frequent bonding sessions. Then the containment hold is a gentle way of holding your baby that provides a sense of security, like a soft hug. So you use both your hands to support their head, their chest, and their limbs so that they feel snug and contained. It helps to reduce their stress and it makes them feel safe, which stabilizes their breathing and heart rates. Even if you can't do skin to skin yet, containment hold is a wonderful way to connect with your baby. And then a hand hug is simply resting your hand gently on your baby's tummy or chest, often with their small hand or arm wrapped lightly around your finger or palm. It's a quiet, loving touch that provides comfort and reassurance to your baby. Your baby feels your presence and warmth through this simple gesture, which helps to reduce their stress and supports their overall stability. Talking or singing softly to your baby comforts them and reminds them that they are safe. Helping with little things like changing nappies or taking their temperature can also build connection and lets your baby know that you are there. Even when they are so tiny and covered in wires, you are their constant, the person that they know best and trust the most. Just a note about touch. When you do touch your baby, it's really important to do so with firm, gentle pressure because it provides a calming and organizing effect on their nervous system. So light or quick touch, on the other hand, can be overwhelming or even startling for a fragile baby and might cause a stress response. So when you hold or touch your baby, aim for slow, firm, soothing contact to help them to feel safe and supported. Babies in the NICU might need extra support to reach their milestones, not because something is wrong, but because they've had a tougher start and deserve specialized care. Occupational therapy and physiotherapy work closely together to support your baby's sensory regulation, their movement, posture, and overall development. OTs start by helping your baby to feel calm and secure by using specific sensory input and gentle positioning to recreate the comforting feeling of the womb. The The physiotherapist starts by supporting breathing and lung health, and later the OT and the physio work together to help build strength, posture, and coordinated movement. Together, the physio and OT lay the foundation for brain development, bonding, feeding, and sleep. And this collaborative support leads to real benefits. Babies spend less time on ventilators, they move to oral feeding much sooner, they tend to have shorter hospital stays, they tend to sleep more deeply and show calmer, more regulated behavior, all of which promotes faster, more integrated development and decreases the risk of neurodevelopmental difficulties later. It might appear that OT and physio do similar things. That's because repetition is how we support the growing brain, so the more often they get the input, the better. Therapists also provide ongoing assessments and adapt their care to meet your baby's changing needs. You can ask for OT and physio involvement if your baby is stable enough. Medical aid does recognize it as part of the NICU journey, and medical aid does cover it in full. Ideally, your OT and physio should have specialized training in the NICU to ensure safe and effective support. But remember, you are your baby's most important therapist, and physio and OT are just there to guide and support you. I have created another 10-minute YouTube video that goes into more detail about how OT and physio support babies in the NICU, so feel free to check that out if you'd like to learn some more about that. And then your mental health, really important. Your baby is in the NICU, but so are you. The journey affects your heart and mind as much as your body. Taking care of yourself is not selfish. It's a vital part of caring for your baby. Members of the NICU team will check in with you regularly about how you are feeling emotionally and mentally. It's really important to be honest with them and with yourself about where you are at. Sharing your feelings helps the team to support you better. Remember, help is available and you don't have to carry this all on your own. Many parents experience what we call NICU trauma. Feelings of anxiety, hypervigilance, flashbacks, or intense worry. It's not a sign of weakness. It's love under extreme stress. Postpartum depression and anxiety can still happen, even in the NICU environment. If you find yourself feeling overwhelmed, hopeless, numb, or disconnected, please reach out. Therapy, counseling, and medication are lifelines that can help you heal, and they are not signs of failure. Taking care of your mental health matters because your well-being has a profound impact on your baby's recovery and development. Babies are incredibly sensitive to their parents' emotions. When you are calmer and cared for, your baby feels safer and can regulate better. Try to find tiny moments of rest. Even 10 minutes of quiet can make a difference. Accept help with meals, siblings, or transport. Simple breathing exercises done next to your baby's bed can help calm both of you. So for example, you can try taking a really slow deep breath in through your nose for a count of 4, hold it gently for 4 seconds, and then slowly exhale through your mouth for a count of 6 or 8. And you can repeat that cycle 3 to 5 times. You can put your hand on your belly to feel your breath deepen, and that really helps your body to relax and sends calming signals to your baby. Another calming technique is box breathing. So you inhale for 4 seconds, hold for 4 seconds, and exhale for 6 or 8 seconds, making the exhale longer than the inhale, and then pause for 4 before repeating. And that pattern encourages your nervous system to shift into a calmer state. You can also press your palms together gently in front of your chest, which is a grounding gesture that helps to focus your attention and promote inner calm. And practicing those simple techniques during your NICU visits can really help with reducing stress and bring a peaceful presence to both you and your baby. Remember, strong parents ask for help. The NICU journey is not meant to be walked alone. Reach out to your care team, family, or support groups when you need support. You don't have to do this by yourself. Once your baby is breathing well and feeding steadily, they'll be ready to go home. Before discharge, you might have the chance to spend a night in the maternity ward, rooming in with your baby, This special time allows you to practice feeding and care routines and get comfortable with your baby outside of the NICU environment, all with support nearby. Your pediatrician, your OT, and your physio will schedule follow-up appointments after you leave. These visits are very important to monitor your baby's progress and ensure that there are no physiological or neurodevelopmental concerns. Early intervention through OT and physiotherapy helps support your baby's movements, posture, and sensory development, which are all crucial for brain growth. Often, our NICU babies move in different ways compared to full-term babies. Normal movement patterns in infancy are not only important for physical milestones, but also for healthy brain development. When your baby moves in natural, coordinated ways, it supports the wiring of their brain and it helps them to learn and to grow. If our NICU babies' unusual movement patterns are left unaddressed, they can influence how the brain develops. So early physio and OT help to identify and support your baby's movement so that they can develop in the healthiest way possible. By encouraging normal, coordinated movement patterns, we are helping to shape your baby's brain and body for the best possible future. Going home is scary and exciting all at once, and that's completely normal. Follow-up physio, OT, and medical visits aren't a sign that something is wrong. They are part of giving your baby the best start possible. You and your baby will learn each other outside these walls in the NICU, and that's a beautiful new chapter. The NICU isn't just where babies grow stronger, it's where parents discover their strength too. You are doing enough. You are enough, and you are your baby's safe place now and always. To honor that and to end off, I'd like to share a poem that has brought comfort to many parents walking a similar road. The poem is called Welcome to Holland by Emily Pearl Kingsley. When you're going to have a baby, it's like planning a fabulous vacation trip to Italy. You buy a bunch of guidebooks and make your wonderful plans. The Colosseum, the Michelangelo, the gondolas in Venice. You might learn some handy phrases in Italian. It's all very exciting. After months of eager anticipation, the day finally arrives. You pack your bags and off you go. Several hours later, the plane lands. The flight attendant comes in and says, "Welcome to Holland." Holland, you say? What do you mean, Holland? I signed up for Italy. I'm supposed to be in Italy. All my life, I've dreamed of going to Italy. But there's been a change in the flight plan and they've landed in Holland, and there you must stay. The important thing is that they haven't taken you to a horrible, disgusting, filthy place full of pestilence, famine, and disease. It's just a different place. So you must go out and buy new guidebooks and must learn a whole new language, and you will meet a whole new group of people that you would never have met. It's just a different place. It's slower paced than Italy, less flashy than Italy. But after you've been there a while and you catch your breath, you look around and you begin to notice that Holland has windmills and Holland has tulips. Holland even has Rembrandts. But everyone you know is busy coming and going from Italy, and they're all bragging about what a wonderful time they had there. And you will say, "Yes, that's where I was supposed to go. That's what I had planned." And the pain of that will never, ever, ever go away, because the loss of that dream is a very, very significant loss. But if you spend your life mourning the fact that you didn't go to Italy, you might never be free to enjoy the very special and very lovely things about Holland. It's okay to grieve the Italy that you didn't get, the loss of the birth that you'd hoped for, the early cuddles that you'd imagined, or the smooth start to life that every parent dreams of. These are real losses. Grief and joy often sit side by side in the NICU, and whatever you are feeling is valid. You don't have to rush through it or hide it. There is space here for all of it, for the love, for the fear, the pride, the sadness, and the fierce hope that lives in every parent's heart. As you walk this path, know that you are not alone. The NICU team, your family, and your community are here to support you every step of the way. Your strength and love will carry you and your baby forward towards healing growth and bright moments yet to come. Remember to be kind to yourself in this journey. When you are ready, reach out and ask for help and hold on to hope. If you'd like more support after your NICU journey, I've created a detailed online course specifically for parents of babies in the first year of life. It covers all aspects of development, including sensory processing, motor milestones, feeding, sleep, temperament, bonding, and more to help you feel confident and empowered as your baby grows. The course is available for purchase on my website, and as a NICU parent, you receive 30% off. You can just use the coupon Little Lives NICU at checkout. You don't have to figure it all out on your own. This course is there to walk with you through the months ahead. Thank you so much for listening. I hope that it was helpful, and all the very best in your NICU journey and going forward.